Hello, and thank you everybody for joining us for our final episode of the 2020 Family Orientation video series. Over the summer, we've introduced you to a variety of offices, and hopefully you've learned a little bit more about the resources available to your student and how they can access those resources when they're on campus. Today, we're going to be talking about COVID planning. Now, at the point that you will be seeing this video, we are already there. Many of your students will be moving into the residence halls and the RIT inns starting tomorrow and throughout the rest of the week. Some of your students will be moving into university-sponsored quarantine at a hotel, and some of your other students might have been here for the last week in independent quarantine. But at this point, you should have already known the things that the students had to do to get here, including producing a negative test, taking the daily screening, quarantining when possible, and all of those other things. So in this video, we are really going to be focusing on the fall and what we think campus will look like from here on out. Joining me today are 3 staff members who are not just experts in their own areas, but have also played vital roles in planning the opening this fall. So first of all, thank you to Nicole and Jim and Wendy for joining us today. And I'm going to start out by asking each of you to introduce yourself, explain to our families what it is you do on campus regularly, and a little bit about the role you've played in planning for opening this fall. So Nicole, would you like to start?
Sure. Hello, everyone. I'm Nicole Boulay. I'm an Associate Vice President in Student Affairs. And normally I work in overseeing our residential communities, many of our campus activities, leadership and civic engagement, and lots of other areas on campus, as well as working closely with Chelsea and our Parents and Families program. During our response and fall planning over the past few months, I have been co-chairing the Community Readiness Committee with Wendy, and she'll, I'm sure, talk about that as well, and have served on a number of other committees that have been part of the fall planning and readiness process. So I've been pretty close to a lot of the decisions that have been made and feel pretty well informed about our campus response as we prepare to welcome all of your students.
Jim, would you like to go next?
Sure. I'm Jim Myers. I'm the Associate Provost for International Education and Global Programs. My day job, as Chelsea put it, is I oversee our global campuses, study abroad, international research projects, all of our international exchanges, and that kind of thing. Really, since January, I've done nothing but work on COVID since we shut down our campus in China and chased the virus around the world. And for our fall readiness, I've been responsible really for our physical distancing plans and classroom environment. And looking at the protocols and standards that we're implementing there. Like Nicole, I've served on, I think, 4 or 5 different committees related to various aspects of implementing our safety plan, including our student safety plan, our workplace safety plan, and our RIT Ready plan that was submitted to New York State, and feel like Nicole also feel quite close to many of the decisions that were made and the guidelines and protocols and ways that we're going to go about opening in the fall.
Thank you, Jim. And Wendy?
My name is Wendy Gelbard, and I am a physician by trade, and I've been at RIT for about 5 years, and currently am situated within Student Affairs as the Associate Vice President of Wellness. So typically the areas that I work with are those folks that work on programs and service to students related to health and well-being. So that's our Student Health Center, our Counseling and Psychological Services, our Disability Services Office, and our wellness programs and services. And like everyone on this call, we have been working COVID nonstop. Jim got a little head start because he was working on the programs in China, and Nicole and I really started diving deep in March. And I've been involved in committees to develop our strategies to keep the campus safe, and that has included some of the physical changes that we made on campus in order to keep us safe, related to changes not only in physical distancing, but in making our bathrooms more touchless than they have been in the past, testing procedures, any sort of mitigation efforts, and educational plans. We just rolled out an educational module that is required training for students and staff and faculty. And we have all sorts of campaigns to really keep the importance of COVID and COVID spread prevention on everyone's mind.
Great, thank you all for those introductions. Parents and family members listening, as you can see, we really do have 3 true experts in the room here, so they are a great resource for this video. So we know that parents are preparing today, as they're watching this video, to send their students to RIT. So we're going to start with an easy question. We know parents are going to be missing their students. So throughout this semester, are parents able to visit their students on campus, or are students able to go home for a visit?
I'll start with that question, Chelsea. So we are, for obvious reasons, discouraging a lot of travel that would take students out of this immediate area once they're here, and that would include travel from other people to come to the area. There are certain restrictions for people who would be coming to campus as visitors, whether that is a daily screen that they might need to do on a day that they might be visiting, or other protocols that either will be in place at the beginning or could be put in place throughout the term based on our monitoring of disease spread in the area and what protocols we may add. So it would be important, if you do plan to come to the campus to visit with your student, that you check with the website and make sure that you understand what the protocols would be. For students, they certainly can travel around within our local area, and they can go to Wegmans, they can go out to restaurants and things like that in the area. Of course, following the appropriate distancing and mask wearing, washing their hands, and all of the right protocols that they should be doing, probably in your home communities as well right now. Those things still are in place. We are, though, strongly discouraging travel for students in or out of the area that it would be unnecessary at this time. To manage once we bring our community together, we want to keep them together in space.
Thank you, Nicole. So I think my next question, Wendy, I'm going to target you here. I think this is probably on a lot of parents' minds right now. What happens if a student gets sick?
So I'm going to take that to mean what happens if a student gets sick with COVID-19.
Yes.
Is that the question? Okay.
Mm-hmm.
So we do have a good plan in place. So as has been mentioned, we expect all students to participate in what we call the daily health screen. And that's a series of questions to determine if a student has any symptoms suggestive of COVID. And we recognize that some students may have symptoms that you might put into that COVID-related symptom bucket, but it may not be COVID. Someone may have a sore throat, and they get a sore throat always at this time of year, and it's due to their allergies. So if someone answers yes to any of the symptoms that could be concerned on that daily health screen, they will be instructed to call the student health center. And if the student health center doesn't get a call from that person, they will reach out to the student to discuss those symptoms. And if those symptoms remain concerning, then immediately we will have that student either evaluated in the student health center or evaluated more likely via telemedicine, so that we don't put at risk other students across campus. And if that student needs a test, we have a special area that is set up in order to do what we call testing for cause. And that means testing if anyone has any symptoms. Immediately after that test is taken, we will then transfer the student in a safe manner to a designated isolation spot that is on campus or adjacent to campus. Prior to that, we will have material given to students. You may need to be in isolation for up to 2 weeks, so make sure you bring any necessary supplies with you, your laptop, your game paraphernalia, whatever it is that you might need that is going to keep you happy for the next 2 weeks. As well, we will enroll those students in an additional application that will require them to input information twice a day. Check your temperature twice a day. We'll be distributing thermometers to all students actually when they arrive on campus. check your symptoms every day, and we'll be making contact with students on a regular basis. When they enter symptoms into this application, if they're concerning, we will be alerted immediately and we will reach out to students. And that reach out will either be via telephone, via telemedicine, via text, whatever way the student prefers to be reached out to. And then if we have indeed a greater concern, we'll step it up even more. We have the ability to assess students in a really stepwise manner. We have a great staff in the health center. We have physicians, nurse practitioners, physician assistants, RNs, and we are accustomed to taking care of students. You know, that's our business. We've been doing that for many years. And it's not unusual for other reasons for us to evaluate students and to find them to be ill enough that they require a higher level of care. Whether it's a chest x-ray, we can help to arrange for that. We sometimes have to transfer students to the hospital if they become very ill. That is a rare occurrence, but we do have a process by which we can do that. As you know, the large part of people who get COVID tend to have symptoms such that they can really treat themselves with symptomatic relief. When those students go into isolation, we have a process set up by where they will be delivered 3 meals a day. We have laundry service prepared. We will have reach out from our residence life staff if they're students that are living on campus, or from our campus life staff if they're students that are living off campus. So we feel like we have pretty tight control over those students who are tested or those students who may be symptomatic.
Excellent. Yes, absolutely. That was great information about what happens to those students. So building off of that, can you talk about what would happen if somebody a student has been in contact with gets sick? So a roommate or a classmate, what happens for the student in that case?
Sure. We're training a team of contact tracers who will be working very closely with our Monroe County Department of Health. So as soon as a person gets a test sent, we're not necessarily going to wait for the results. We're going to start looking at the potential contacts that a symptomatic student might have had, because we don't want to risk the spread of illness. Certainly if a test is positive, we will most definitely be reaching out to students to find out who they have been in contact with. And there are lots of levels of contact. So we don't need to know if a student who tests positive just passed by a student in the hallway, because transmission of illness is really defined by 3 things. It's defined by length of contact. So that would be usually defined as 10 to 15 minutes of face-to-face contact without people wearing a face covering. It's also defined by frequency of contact and by dose. So if someone sneezes on you, that might be more concerning than if someone just, passed by someone in a hallway. So as far as a student in a classroom, if a student in a classroom tests positive, they'll be sitting in that classroom because of the awesome work Jim Myers and his team has done 6 feet away from someone else, and they'll be wearing masks. So the risk will be really negligible, if any at all. So we're looking for the contacts where, we're sitting around in a common area and, sorry, we forgot to wear our masks. And, those are the people that we would really be concerned about, or roommates. And we would reach out to those people. We wouldn't necessarily disclose who it was that was infected or symptomatic or test positive, but our contact tracers would sensitively, is that a word? In a sensitive manner, say, through our contact tracing, we understand that you have been potentially exposed to someone with COVID-19. So we're going to ask you to be in quarantine for 2 weeks. And similarly, they will be transported to a place for 2 weeks, and they would have the same support as someone in isolation, but they wouldn't have symptoms. They wouldn't necessarily be ill. And our academic side has figured out a way to support students so that they don't fall behind in their coursework. They would also have similar meals delivered, and they would have laundry service and contact from our Res Life staff or our campus life staff. So similar process, one though is known and one we're just putting in quarantine.
Great. And I just want to take this minute because of something you just said to tell parents, if you're a little bit confused about the difference between quarantine and isolation, you should go to the RIT Ready website because there are FAQs that explain exactly what each of those mean. So you can understand what your student would be experiencing if they or someone they know were placed in either one of those. So Wendy, my next question for you, you started to touch on this, but I'm wondering if you can explain in a little more detail about if there's COVID testing available on campus and who would have access to that testing.
So we're doing COVID testing on campus for students who have symptoms or who have very high risk exposure. So that we call testing for cause. In addition, we're doing something really neat and exciting. It's called wastewater sampling. And that's a process of surveillance where we have the opportunity to test wastewater coming from residence halls and university apartment complexes. And we're going to be sending those samples twice a week to a lab in Syracuse. And we'll be able to look at a baseline and see if there's a trend. The reason why that's so exciting is because people shed virus for a couple of days prior to showing any symptoms. And that may give us about 6 days before we see any evidence of illness on campus. So if we see a trend rising from a particular area on campus, we can say we need to do some targeted testing in this particular area to see if this is indeed valid information that we're getting. So we have that surveillance and we have testing for cause. And we also have individual surveillance testing. So every week we're going to send out emails to students that are chosen in a randomized fashion and say, you've been selected to get randomized testing today. So come to this designated area and get your test. And that will let us know what prevalence, general prevalence on campus is. We're working with epidemiologists and statisticians to make certain that this design of this surveillance process is indeed meaningful. And we'll also be looking very closely at if there are any positives coming from that, what that means. And we might get one person in each of 3 different colleges that test positive, and we may think we just need to isolate those people. But then when we do a deeper dive into who those students are, we might realize that they're all a member of the same club, and then that will lead us to going to that club saying, hey, we're going to test all these club members or all these people who are on this team or all these people that share this bathroom on a particular residence hall. So the hope is to get things really early before there is concern.
That was a great explanation. Thank you so much. And I'm going to let you take a little break because you've been talking so much here, and I'm going to shift to Jim. Jim, can you tell our parents a little bit about what the in-person classroom experience will look like this fall?
Sure. First of all, I think it'll be clear. I mean, the obvious changes to the campus environment will be obvious to students when they walk into the classroom. There's going to be the expectation that everyone is spread out 6 feet from each other in the classroom. As a result, the enrollment in a given class period is going to be pretty much smaller than you're typically used to. RIT never really has very large class sizes to begin with, so taking it down to 50% of our typical size of our classes means that in some cases you'll be in classes that are very small, 5, 7 students. At the same time, in many cases, the whole class will be actually engaged through a mix of face-to-face and online. So walking into the classroom, you'll only see half of your classmates, but the other half will be available to you online. And I know our faculty are working really hard to figure out how to make that a very engaging and opportunities for students from the entire class to really interact with each other. I think the other thing will be the shielding. There will be barriers in front of the professor to protect students from the professor. Everyone will be wearing a mask. That is a requirement whenever anyone is indoors at RIT, that they don their masks and keep them on until they're either eating or by themselves in a closed space. So in the classroom environment, I think those will be the major things that people will see. I think the things to be aware of that sort of are unique to this environment, other than the things that are going to be very obvious and almost, I think, expected. One thing will be there won't be any eating or food in the classroom, no drinking in the classroom. So we're going to be encouraging students to do that only in designated places. You're going to be expected to check in to a location as part of the contact tracing work that Dr. Galbard's been developing. We have a QR code at the front of the room, and students, as soon as they walk in, they'll have to check in with their location in the classroom to let people know that they're there and who else they're in the room with. Should be a very seamless process. I think the other thing is that we're placing a lot of emphasis on classroom hygiene and sanitation, and so cleaning and wiping down your space as soon as you come into the classroom will be part of it. Clearly, under normal situations, none of this probably would exist. But we've taken every measure to ensure safety on campus. The classroom environment is one of those spaces where, for a prolonged period of time, hour or more in some cases, students will be together. And so adhering to one, really good personal sanitation, washing your hands, don't touch your face, wear your face mask, stay 6 feet apart, check into the room, wipe down your surfaces. And then, I think once that's all sort of taken care of and becomes part of our daily routine, the work of learning, and it'll be the same great learning experience. Our faculty are still the same faculty. We're still very committed to leveraging technology in the classroom to ensure that students get to do all the experiential things with their teammates and in groups that they would normally have an opportunity to do. So I think that's pretty much a summary of what it's going to be like.
Great. And we know there are a few other places on campus that are maybe a little more high touch that students need and value. I'm thinking things like the labs and the libraries. So Jim, can you talk a little bit about if they'll be open, how they'll be open, what those might look like?
Yeah, I would say, one of our driving forces of really wanting to be open this fall has been the fact that we are such an experiential, our pedagogy, our teaching method is so experiential. We place great emphasis on labs and on studios and on workshops. And so they're all open. They will also be properly spaced. Expectation, in some cases, in some of our labs, we have an enhanced protocol for shielding. We've improved airflow in those spaces because sometimes in those lab spaces, they're a little bit more, I would say, congested typically, but we're spreading people out. We're increasing the airflow. We've put some enhanced shielding in some of those spaces. But for the most part, the lab and studio experience will be very similar to anything that the student might normally expect in a classroom kind of environment. Still have to do the check-in, but they're all open. The library is open. The library will not have as many study spaces as it normally does because of the physical distancing requirements. We're in the process right now of identifying additional study spaces across campus so that students will have a place to go to sit and study outside of the library. But yeah, everything's open and we'll be open as it normally would.
So Jim, that was a great explanation of what academics will look like on campus. So thank you for that. Nicole, would you like to talk a little bit about what campus life will look like? Will students be able to participate in clubs and intramurals and activities? What will the outside of the classroom experience look like this fall?
Sure, absolutely. So I'll start by saying kind of what Jim said at the end, which is that we are planning to be fully open for business, and many of and almost all of the same activities that a student would have expected to experience outside of the classroom will be there. The difference is that they will have modifications. So similar to the classroom, there will be distancing, obviously face covering requirements, and there may be modifications to the way in which we need to do something. So clubs and activities and all of those kinds of things, they will continue to meet, just like the classroom experience and just like many of us have been experiencing in our work environments and other places over the past few months. They also will probably operate with some kind of hybrid where they may have some meetings together when they can do that with spaces with appropriate distancing and activities, and other times where they may very much be in a setting like this where they're having an e-board meeting, but they're coming together on Zoom rather than in person. They may have some people together in person and others on Zoom to, manage the distancing that they need, or to support students who may need to be in quarantine or in isolation for a period of time, but want to stay engaged with their friends and activities, or who just need a day or two to step away from the more populated environment and want to be in that kind of remote access. So we have all of that set up, and we're planning on that with our activities. We have done some enhancements of some things that are even better than we would normally have, I guess. We have invested in a very significantly sized outdoor stage that we will have from the beginning of school or very close to opening right through, we're hoping Halloween, so the end of October. And weather permitting, October is a dicey month in Rochester, you never know, but we're hoping for sun and warmth through October. And that is a very significantly large stage where we can do performances, activities, performing arts, lots of things, because it's outdoors. So it will allow for some things that would otherwise be more restricted indoors. It has a larger capacity for people who can attend events, as well as what can be performed on the stage because of it being outdoors. In addition, we can show movies out there, so that'll be kind of a fun evening activity and something we can do, kind of, come out and be appropriately distanced, but sit on the lawn with your blanket and kind of hang out and watch a movie. So that's exciting for us and gives us a nice space to be able to do some things outdoors that we normally would have done indoors. There are certainly some restrictions and some activities that will either have to look significantly different or may be on pause for the fall. And those would be some things in some of the performing arts areas where we either have to have a very significant difference, 10 to 12 feet of distance. And Wendy could talk more about the science behind that, but I think most people understand if you're singing or playing an instrument or something like that, you need a greater space between people, especially if you can't wear a mask because you can't play a trumpet with a mask on. So those would either need to be outdoors or have significant other protocols. So those things are still being kind of finalized and looking at what our options are. So there'll be some impact on those activities, but we're working hard to be able to identify spaces where those things can continue. And then there are some contact sports or higher contact activities where people would normally be in close proximity. Rugby is an example that comes to mind. And those are activities that would be on pause for the fall because they just can't be done safely at this time. So for most activities and most things, we will be doing them. Wendy might want to speak about wellness classes and outdoors. She's the expert there, so I'll let her talk about that. But most things, again, as Jim said, like with the classroom, we're forging ahead and just doing so with modification.
Wendy, did you want to add anything to that, or did Nicole cover it pretty well?
I think Nicole covered it pretty well. I would say that we have wellness classes that all students must take at least 2 of prior to graduation. And a lot of those classes are related to physical activity, not all of them, but many of them. So we're being creative in how we're offering those classes. And we're going to be offering them outside, weather permitting, because that's an area where we can physically distance and there's the best airflow, air exchange that you could hope for. And if the weather isn't good, we have alternative online opportunities that students can meet the learning objectives of the course. So, I think there are a lot of people involved in really thinking outside the box in order to deliver a really quality education to students in a lot of different ways.
Thank you both. So even though our parents are just starting to move their students in this week, we know that a lot of them are looking ahead, knowing that there's not any breaks this semester and looking ahead to when they can see their student again. So can one of you tell us, should students plan to leave for the semester at Thanksgiving with the way the schedule works?
I can take that one, and then Jim and Wendy could jump in if they want to add anything. So for students who are living whether on or off campus, they do not have to leave at that time. they can stay in their residences, and we know that some students will prefer to do that. They may have a little bit quieter study space than they may have at home with siblings and family members around. They may have better Wi-Fi and bandwidth and all those things that matters to our students. So they may choose to stay. Some students may choose to stay for a period of time after the in-class experience ends around Thanksgiving for a period of a sort of semi-quarantine before they travel home to family. Depending on where they're going to, and if that's something that makes a family feel more comfortable. So they may stay or they may choose to go home. Some students, I expect, on the last day of classes, on that last day of in-person classes, before the break, will get right in their vehicles and head home. And others will choose to stay throughout that period of time. So they do have a choice, and it's whatever really works best for them and for your family.
And I would add to that in that it is indeed whatever works best for the student, but thinking about the reason why we are making that offer available to students. And that is because many colleges and universities across the country have adopted a similar plan, thinking that traveling home and then returning to campus might be risky, in both directions, that travel. So minimizing travel, minimizing exposure to a family if a student travels over Thanksgiving, comes back to campus, and then goes back over the winter holidays. All of those events are, have some element of potential exposure. So we're really trying to limit exposure. Certainly we can't eliminate it, but we can do our best to limit exposure.
Mm-hmm. So on that note, we know that there have been so many people, the three of you included, who've been working really hard to make a plan to keep our campus safe. But not everything always goes as planned. So can we talk about what do we know about the plan if things do go bad again? What will we do in that case if that happens prior to Thanksgiving?
Well, I think one thing to keep in mind is that it's not a light switch. So things aren't going to go bad overnight. We'll have indication of trends, and that will be measured on a daily basis. We'll be looking at wastewater management. We'll be looking at results from our testing for cause. We'll be looking at results from our randomized testing. We'll have an idea as to what is the participation in the daily health screen. And if people aren't participating, we will be reaching out to them, because that is a requirement, and strongly encouraging them to engage in that process. We'll know if people are entering in positive symptoms. So we'll have a lot of information, and we are working on creating a dashboard into which all of this information is fed. And so we will be having frequent discussions as to next steps. We don't have to immediately jump to worst case scenario, but we can say, we're seeing a lot of activity in a particular residence hall. We're going to say to the students in this residence hall, hey, no face-to-face activities this week. Let's see if we can tamp down the noise that we're seeing from your area. We might say no face-to-face classes for a week, or no classes in a particular college if we see some activity in a certain area. So we have lots of intermediate steps that we can take in order to help control what we're seeing on campus.
Chelsea, I'll just say from the academic perspective, we're committed to academic continuity. I think quite honestly, one of the great innovations and areas that we've learned a lot as an institution from our experience in the spring has been the extent to which we're able to, I think, ensure that students can continue to make progress towards their degrees, that they have access to their professors, that they have access to the course material, that they can have a rich experience remotely. And, I think we've learned a lot. One, we were good at this to begin with. RIT is innovative in this way anyway. The extent of having to do it sort of en masse during the spring semester, we're ready academic-wise to ensure that students can continue to make progress in their classes, have a good experience in their classes, and really deliver on the academic promise of RIT.
Thank you both. So if For the families who've been watching these videos, they've heard me plea and every single one to make sure their student is prepared to, wash their hands, wear their masks, practice distancing. And we as staff are asked to do that as well. So Nicole, can you talk a little bit about what happens if students or employees don't follow the guidelines that we're asking them to follow when they're on campus?
Sure. So our primary emphasis is on education. And Wendy spoke earlier about some of the campaigns that we have, signage that we'll have around, and much of those educational components. And so the first step in any successful accountability plan is individual accountability. And so whether it's the taking of the pledge, completing of the training, following the signs, the first step is to be responsible for yourself. And I'm very encouraged by the fact that we've done a number of discussion groups and surveys and other things that some of you may have taken part in, and really asked people how they were feeling about their own willingness to do their part. And we have had 90, 95% of people saying, absolutely, I'm 100% willing, strongly agree that I'm willing to do my part. And so that's really the first step. The second step is helping one another. And so if you see someone who just forgot to pull their mask up after finishing their meal, or maybe is getting a little bit too close, or forgot their daily screen today because they fell out of habit, they slept in a little bit and didn't get it done. That the first step then, or the second step then is just reminding people, and those gentle reminders and support of our community to have people comply with what it is that will keep us all the safest. However, we know that even with all of those steps, that there will be people who either are forgetful enough on a regular basis that they're not following the rules, or who are making choices not to do that. That we will have an accountability program at that higher level. There will be a particular reporting form, an online form that individuals can submit, letting us know that they have a concern and who they have that concern about. And with as much information as they can provide, or if they have a concern about a particular area, on the first floor of the library, I've noticed a lot of people with this behavior and it doesn't seem like anyone is addressing it. So they'll be able to share that kind of information with us. We will be reviewing those in an expedited manner. So really the day of, when we receive them, someone will have eyes on those and looking at that information. The employee-related situations will be handled by our human resources area, student concerns by student affairs, and then the facility-related concerns by our finance and administration department and environmental health and safety specifically. So we'll be looking at those and mediating them. In some cases, it may be a reminder to someone of what the rules are, making sure that they're clear and they understand the expectations. It may include re-education or retraining, or it may include more punitive types of measures if someone is really willfully choosing not to follow the rules and needs a little bit more encouragement to do that, up to and including removing someone from campus if that's necessary. And that would all be through our standard student conduct protocols or employee-based protocols for those things, but all done in an expedited manner. So it won't be 6 weeks till you have a hearing about this if you refuse to wear your mask in class. It'll be right that day. You'll be asked to leave the class. You will not be able to stay, and we will meet with you and help you understand that you need to wear your mask in that situation. And if you refuse to do so, then you won't be allowed to attend class. So we're very serious about the accountability, but we're also really hoping that we won't need to use those sticks as much as we will focus on the carrots. So we want a field of carrots and just a couple of sticks at the end.
Thank you so much. So I have one last question for you all. We have been spending so much time focusing on the fall. Your response might be really short, but have we been thinking at all about what's going to happen this spring?
I mean, I will say from the academic affairs standpoint, yes. I mean, we're thinking about it. I would say what we're doing is running scenarios and thinking about what we need to do if this continues even through early part of the winter or late winter into February. We haven't made any decisions, but I know we're talking about scenarios and what we might do. I think that's where a lot of us are, is sort of contingency planning around what might happen. But hopefully we won't have to worry about it. So.
I think that makes sense, keeping everything in the back of our mind and knowing we have to see how the fall and winter go, but that we don't want to be in a bind. So we're thinking about it now. So that brings us to the end of our questions. Nicole, Jim, and Wendy, I know your time is very valuable, so thank you for taking this hour to come and talk with our parents. To the parents and family members listening, thank you as well for joining us. You are approaching the end of your family orientation experience. You will be receiving one more family orientation newsletter from me next week. And at that point, I will be moving you over to our regular RIT parent newsletter list. So you're not done hearing from me quite yet. That newsletter goes out once a month, and it will remind you of things happening on campus, reminders for your student, things like that. And that list is also used in case there are any emergency updates or notices that we need parents to know right away. So thank you, all of you, for joining us again. And parents, if you're moving your students into campus this week, I look forward to seeing you there.